Well, back home as the debate continues over the national health insurance. Today, we look at the role of occupational therapists in society and how they contribute toward the delivery of quality healthcare. Well, joining us in studio is Andiswa Gowa, the founder of the Andiswa Gowa Practice, a medico-legal focused occupational therapy practice, rendering services in Gauteng, KwaZulu-Natal and the Eastern Cape. Good afternoon, Andiswa, and thank you so much for your time on the SABC News Desk.
Good afternoon, Keshni, and the listeners.
Andiswa, before we get into it, do you want to give us a brief overview of what occupational therapy really is and what the field entails?
All right. Occupational therapy is one of the clinical disciplines that deals with rehabilitation. It works with the doctors within the hospital settings and even outside hospital settings. But the main focus is on rehabilitation. As the word says, occupational therapy, it means one has to, if you are a therapist, you need to be able to take the individual back to their own functioning or back to their own occupation if they were injured or they were impaired or if there are children with learning problems. So it's quite a diverse kind of an intervention, but you can find it both in hospital and outside hospital.
And there is a misinformed perception out there, Andiswa, that occupational therapy deals only with persons living with disabilities, when it's a far more wide-reaching sector.
Yes, because as I've said earlier on, it deals with the functioning of an individual. So you don't have to be completely physically disabled to be able to go to the OT, but you would need, what we focus on is the functioning of an individual. Because there's also inclusion of the mental health, physical health, and general vocational rehabilitation. So as I said, it's diverse, so the intervention is required in different forms.
Tell me, how would a practice of occupational therapy differ from other therapies, for instance, physiotherapy for that matter?
All right, if I can start right at the beginning.
Go ahead.
You'll find that when someone is injured or is ill, let's say you have been diagnosed with a stroke, the doctor will actually diagnose that impairment, and then the physiotherapy will go in and do exercises and so forth. But the occupational therapy will then look at whether the treatment modalities that the OT renders helps you to be able to go back to work or to go back to school or to go back to how you were functioning prior to the impairment. So the treatment can be rendered, but we take a step further in making sure that you go back to your functioning. Yeah.
Now, you've really found a niche with your company. Tell us what is it you actually offer, what services you offer, and why there is such a crucial need for services like this in the country at this juncture, Andiswa.
Yes, Keshne. I am known as an occupational therapy who deals mainly with medico-legal work. Medico-legal work, which is the combination of the medical side of issues with the legal aspect, where there can be a personal injury claim arising from the motor vehicle accident or arising from medical negligence cases or medical malpractice cases, which we know in South Africa there's quite an increase in the medical malpractice cases where occupational therapists are involved in the assessment and then involved in the treatment of the individual. So if I can say, my specialty now, we deal with the assessment of those individuals and making sure that the road accident fund is able to compute the compensation for the particular patient, or the Department of Health is able to compute the compensation depending on whether this person will be able to go back to work or not.
Andiswa, in your line of work, of course, you have to interact with a lot of patients. Would you say generally, overall, South Africans are adequately aware of their medical and legal rights, just in your opinion?
I would say yes and no. As we can see, the health sector now is quite flooded with claims for medical malpractice claims. So you'll find that the contingency bill is quite high that the department is having to deal with. It's running in billions, I must say. So that shows that the South Africans are quite aware. But at the same time, you get into areas where people are not sure or are not aware of their rights. So they will go to the hospital being mistreated and they won't know whether they have to act or not. So it's a yes and a no, but we have seen a rise in the medical negligence cases in the Department of Health.
Andiswa, there's been so much of talk of the national health insurance recently. How is that going to impact on the field of occupational therapy going forward, do you think?
All right, let me have a disclaimer first, because the Occupational Therapy Association of South Africa has not indicated their stance regarding this, their position as yet. But as an OT, we feel that this is, I feel, let me not say we, I feel that it's very important for people to have access to medical health, through the national health insurance. Recently, I've been to London in a conference where we're dealing with innovations and technology, and health became one of the main sector that we needed to be looking into. So if people can have access to rehabilitation, for example, in the medico-legal space, you'll find that there will be lesser compensation that is required, because rehabilitation will be offered by hospital, or rehabilitation will be offered by private occupational therapists in partnership with government. Unlike now, you'll find that there is a case of a road accident fund, then someone has not, you'll find that the claimants have not received full treatment or rehabilitation, and then they queue in for compensation. So we need to reverse that process and actually look at what can be done for the management of the conditions prior to compensation.
Just on the point of the NHI, critics of this plan have often said that it might contribute to the brain drain, an ongoing brain drain from South Africa. I just want to garner your thoughts on that, Andiswa. Will it lead to us losing even more specialized people like occupational therapists in your case?
I've got a different view. I seriously got a different view, because the access will be different now. The access will not be in one area. There will be distribution of people, of practices who are able to offer the services to the public. So I really do not think that it will affect the brain drain, but as I said, I need to have a disclaimer, because the OTASA has not come up exactly and have a stance. But this is my personal view, that we've seen the NHI working in UK, we've seen the NHI working in USA, but just that we need to work very hard to ensure that all the logistics are taken care of, are in place before it is actually implemented.
Andiswa, I want you to take a step back and think back on your OT training. It's often criticized as having an overloaded curriculum for students where they don't have enough time to actually assimilate their knowledge.
That's an interesting one, because I always say South African OTs are the best in the world. Because you'll find that in other countries, the occupational therapy specializes a lot. You'll find that they are found in oncology or in a specialized environment. Whilst here, we are trained overall. We are trained in different areas. Then it makes South African OTs more in terms of diversity. They can get into a rural hospital. They are able to deal with mental health. They are able to deal with physical health. They are able to deal with any challenges that are related to problems in South Africa.
Very quickly, Andiswa, we are stretched for time. We're just wrapping up Women's Month. Your message to young women who may want to pursue a career in occupational therapy.
Okay, I always say, one of the best things being an occupational therapy is that you always have employment. There is no stage where you don't have employment. So it's one of the careers that is able to place people in different jobs because of its diversity. So I always encourage people to join in and try to get into occupational therapy because of that, because it's diverse and you will never be in a position where you don't have employment. In South Africa, and even internationally. So it's a known industry, and really, and we also don't have men in the industry. There's few males that are in the industry. So we want to encourage, and now it's becoming lucrative. As I'm saying, we are in the medical legal space where it's paying more, unlike before where it was not paying more.
Yes.
So I always encourage students and pupils to actually get into the field to make sure that they can join and become occupational therapists.
Andiswa, thank you so much for coming through to the Auckland Park studios. It's been an absolute pleasure chatting with you this afternoon. This is Andiswa Gowa. She's the founder of the Andiswa Gowa Practice. Well, time to take a short break. I'll be back with more news after this. Do keep it locked on to the SABC News Channel.